I'm Dale Rader. I'm a board-certified, fellowship-trained orthopedic surgeon at EmergeOrtho. And today we're going to talk about various abnormalities in orthopedics. So a trigger finger is when your tendon catches or locks. Your tendons actually run in a sheath, and so the tendon is made to glide back and forth in the sheath, and sometimes the sheath becomes very thickened and it grabs the tendon, and the tendon either catches or locks, and you have to forcibly move your finger in order to get it unstuck. Symptoms would be catching, locking, or pain in the finger, stiffness, especially in the morning because you haven't moved your fingers all night. Oftentimes patients' fingers are kind of stuck down. They have to forcibly move it in order to get it unstuck. So it's typically pain, catching, locking are going to be your main common symptoms. So again, just like most things in orthopedics, conservative management is going to be your first line of treatment. You know, we are orthopedic surgeons, but we try to get things better however we can, and typically that's always going to start without surgery. For trigger finger in particular, it can be things such as splinting, occupational therapy, and sometimes corticosteroid injections as well. If you truly have a stuck trigger finger, that's one of the things that'll definitely bring patients in. Oftentimes patients, they wake up and it's stuck down. They're usually able to kind of run it under warm water and gradually kind of bend it and straighten it out to loosen it up. But a lot of times those patients will come in and we will do an injection, and that'll usually get it unstuck. Sometimes if it's caught early on, it can improve on its own. So the earlier that we treat it, the better the results are going to be long term in terms of it staying normal. Oftentimes we give patients a steroid injection, and if it's caught very early, that's all they will need. That may last for years and years, or it may never come back. It's the ones that have been there for an extended period of time because the sheath has become more and more thickened, and it typically will not respond to the conservative treatment as well. Absolutely, hand therapy can help trigger finger. We oftentimes will send patients for therapy. They will show them different stretching exercises. There's splinting that they can wear at night and throughout the day, which will help for sure. So sometimes, all the conservative things that we do for trigger fingers are not effective, or they last short-term, temporary. Patients will get several months of relief from the therapy, from the injections, but oftentimes if the pain comes back, then that's when we would consider surgery. And the surgery is minimally invasive. It's a very small incision in the palm of the hand. It takes us literally 10 minutes or less to do. And recovery time is 3 to 4 weeks. So it's very quick recovery, very short surgery, very low morbidity in terms of surgical complications and things like that. And patients respond really well to surgical intervention as well. So typically it is a permanent fix. Sometimes patients can have recurrent trigger fingers, but it's pretty rare they're going to develop trigger fingers in other fingers that haven't had surgery for. Is usually what we would see. Just like with anything, the sooner you see someone about these problems, the easier it is to treat. We would recommend coming in sooner rather than later. The earlier to be treated, the more likely it is to resolve the symptoms completely, especially with the injections. If the symptoms are very early on, they respond really well to the injection to the point where you may not need anything else. And in our new facility, we also have an orthopedic urgent care, which allows you to walk in at any time. There's no waiting. If you walk in the door when our doors are open, you will be seen. And that is something that is new to the Statesville market and adds a whole new avenue for patients to receive care when they need it.